right, Dr. Anthony Ng is here. He's the medical director for Community Services and Neuromodulation Services at Northern Light Acadia Hospital. Nailed that title. I didn't. Yeah, there you go. Let's see. We're talking about disasters we've dealt with. By the time you got here, a tropical storm. How does disaster psychiatry play into the things that we deal with?
So disaster psychiatry is a subspecialty of psychiatry that's really developed in the past 20 years or so. And it really is important because it not only looks at the individuals who are affected by these events, but it looks at community and looking at how to promote resiliency within these communities. That's why it's gaining increasing attention because of all the events.
So you're talking to us a little bit about dealing with a disaster, the threat of it, and how it impacts an individual, and I guess the help that you try to offer.
Yeah, and basically, there's different levels of intervention. One is the individual level, as you mentioned, that you're working with survivors or the victims of the families of those impacted, and then you also work at a system level to help organizations and communities come back. So.
And what kind of reactions might people have when they're dealing with these sort of things?
Yeah. So when they have, these events, a lot of people have what we call abnormal reactions to abnormal events, because these are just some very big events that create a lot of emotions, create a lot of stimulus, and people may have what we call distress reactions. They're not illness per se, but certainly enough to cause them just uncomfortability and disturbance. So it could be like problems with sleep, could be problems with focusing, being scared, and being just startled or anxious.
Is there anything that comes to mind, an example that you think people have dealt with recently, or that maybe?
So a common occurrence is basically when people face with these disasters, feeling of being afraid of the future, like what's going to happen? Am I going to be impacted by this? Is my family going to be impacted? And that leads to uncertainty, because especially you can't predict what's going to happen, leads to people being just kind of cautious, anxious, and so forth.
What are some strategies that people could use to cope or deal with trauma?
The biggest thing we try to promote with disaster psychiatry is reconnection with communities and each other. I think people feeling alone is the biggest risk when these events happen, but when you can connect somehow, whether it's just through just simple communication, talking, or being part of the efforts, volunteering and participating in the recovery of your community, all these can serve to promote your resiliency.
By saying that, you mean people who have gone through similar things and have maybe navigated a path forward to look out for?
That's one group. Yep. If you're going for the first time, because some storms happen where you never had it before.
Yep.
By seeking a common ground with your community members, let's get together a group to, let's say, fix the roads and help each other out, feed each other. Those little things like to help promote your own recovery.
How should people reach out if they went through this, know somebody that went through it? What should they do?
There are many resources online that they can search up for disaster psychiatry, disaster mental health. There are local resources through Acadia. You can reach out to your primary care provider. And don't forget even the faith-based, spiritual leaders as well as schools. Those are resources. So.
Very interesting. Thank you so much for coming in. If you want more information, we'll put up the website right now. It's Northern Light Health or northernlight.org/behavioral. Thank you very much.